Many of them are asking if I have to settle in Middle East, if I have to settle in Dubai, if I have to settle in Oman or any Middle East country. They want to know which specialty is better, like medicine, pediatrics, emergency medicine,
Dependent
anesthesia,
subjects.
nuclear.
Okay, anesthesia, radiology, pathology,
Service
emergency
provision
medicine
sectors.
that you work.
Yeah,
Yes. So I'll tell you my work-life
yeah,
balance or
yeah,
my work style. Maybe it was. So I'll tell you in India how it was. Probably
yeah.
in India, I
Yeah,
would.
India and
So this is very different. So culture of working will be different. Somebody comes here, it will take some time for them to understand. It's not very what I
easy.
think is DNB is much better than MD. It's
Mm.
a fact because in MD in a medical college,
Mm.
jack of all is good,
Mm.
but you need to be a master of something.
Mm.
So probably do a fellowship, if not a DM, just
Mm.
get a fellowship in one of the.
Hello, all. This is Dr. Dheeraj Masapu. Welcome to my YouTube channel. I'm a consultant anesthesiologist. Today we have Dr. Nitin Manohar, who is my friend, and he is an associate specialist and associate professor in Cleveland Clinic, Abu Dhabi. Welcome to the channel, Dr. Nitin.
Hi, Dheeraj.
So, how is Abu Dhabi and how is everything going on there?
Everything is fine, Dheeraj. Life is structured, life is methodical, and I'm on call today. Unfortunately, I don't have any
Yeah.
emergency cases lined now, so I'll
Yes,
have a chat. Hopefully, it will be useful to the viewers.
yes. So now, actually, what is happening in India is a counseling session is going on. A lot of students are getting into PGs from their MBBS. So many people are actually I don't have an idea about which specialty is better for them. Because in MBBS, we will not actually have an exact idea of each specialty. So many of them are asking if I have to settle in Middle East, if I have to settle in Dubai, if I have to settle in Oman or any Middle East country. They want to know which specialty is better, like medicine, pediatrics, emergency medicine, anesthesia, nuclear medicine, radiation oncology, or super specialties like cardiology, nephrology. Which path is better, or surgical or medical? So that nobody has a clue. So you have stayed there for a significant. You have seen different specialties. I know you're an anesthetist, but anesthetist is the best person to know every branch because you're connected to multiple branches, multiple people. So, with your expertise and wisdom, so what do you suggest an MBBS guy? How should he plan from there?
Okay, good question actually. What I would say is, first thing, Middle East is a broad term. People don't understand this. So they say Gulf or they say Middle East. So Middle East itself has different layers, different levels of countries, and different levels of healthcare. So it is not the same. So if you consider the whole of Middle East as a group, then I would say the first group where the best hospitals and the best infrastructure is in UAE. This is the number one country. It is like the US of the West, I would
Okay.
say. So if you say in the West, US will be the number one. So similarly, UAE. UAE is consisting of seven emirates. Okay. Dubai, Abu Dhabi, Sharjah, Ajman, and the rest of the four emirates. Okay. So these
Okay.
are all small emirates. So the most work happens in Dubai and Abu Dhabi. Abu Dhabi is the capital where all the most of the government hospitals are situated, which is the 70% of the land area of UAE is in Abu Dhabi. Dubai is a very small city, but it is a very popular and a very high population and next level city. So a lot of hospitals in Dubai also. So this is UAE, okay, and next will be probably Qatar. I would rank Qatar as the second best country here because they are also coming up in a big. Recently, you would have seen FIFA World Cup was conducted by them. So they
Yeah.
are also very progressive and they are also coming up in a big way. After Qatar will come the other countries, okay, like Bahrain, okay, then Oman, okay. So these are all GCC. GCC is Gulf Cooperation, okay.
Hmm.
So this GCC is the oil-rich countries. So Abu Dhabi, I mean UAE, Oman, Bahrain, Qatar, Saudi. These are the main cash-rich and oil-rich countries. So here the health infrastructure is very good. Rest of the Arab countries, like you can say Kuwait
Saudi.
or Iran or these and so these
Hmm.
are all not very progressive in terms of healthcare and in terms of infrastructure also. Saudi is also coming up now in a nice way that they are becoming progressive. But previously, it was, I would say, the healthcare is very good, but the lifestyle is generally not.
Hmm. I
There
understand.
were some restrictions, but now it is also becoming a free world. But UAE, if you come to UAE, you will not feel anything. You will
Correct.
probably think it is you are staying in Bombay, in the suburb of Bombay or suburb of Bangalore. So you will feel the same kind of structure. So this is about the countries. Next, about subjects, I would like to say that this is the best of they select, the people here are the cream of the world. So I have colleagues who have come from UK, who have come from US, from Europe, from all over the world. I have colleagues working
Mm.
here. So everyone comes here after training to a good level.
Mm.
So if you want, you should never target that I will come to Middle East. Okay, the target should be you will become better, and then the people in Middle East will select you. So they will select the best. They will not select the mediocre people. So most of the best people in any branch only will come here and will get selected and will do well here. So if you cannot target to go to come to Middle East, you probably target to do well in India, and then you will fit in here. So it is like that, and it is not easier to survive. Unlike people think that it is an you can get a job, it will be not hardworking or hours will be less. It is not
Yeah.
like that. It will be very taxing because the
Mm.
expectation is very high and you're competing with the best among the world. And
Mm.
everyone wants to come here. Mind you, every Indian anesthetist would have thought once in his life, "Well, I want to come to this part to make good money and to have a good lifestyle,"
Yeah.
which is what this place offers.
Yes.
So likewise, all the other country people also think like this. So most of the doctors here are very good. They're highly professional and they can survive in any place in the world because of their skills and their educational background. Coming to subjects,
Yeah.
I would say the most popular subjects that come here are the dependent subjects. Okay,
Mm.
anesthesia, radiology, pathology,
Service
emergency
provision
medicine.
sectors. Yeah.
Yes, so these are not very popular in India. You know, being an
Mm.
anesthetist in India,
Yes.
how much ever you work and do well and you get a name, you will reach a
Yeah.
plateau.
Yes.
So that is why many people, when they reach that plateau, try to move to these countries because
Good.
financially or in terms of lifestyle, quality of
Yeah.
life, this offers a much better platform for all. So, but the surgical, physicians, these people do not come here, and I would say it is not best suited for them. Why? Because you have to compete with the Western people. So if a patient here, most see the population here is also expat population. 50 to
Mm.
60% of the population here is expat population. You mean all the other country people have come here for work. So
Okay.
they will select the Western people. If you
Got
have
it.
a Western doctor, they will go for that surgeon, or they
Got
will
it.
go for a US trained or a UK trained. So Indian doctors are also popular among
Mm.
Indians and among our community and our ethnic backgrounds, but the market is less.
Got
So the
it.
scalability is less. So if you are an Indian surgeon and you are doing very well, you will not come here because probably financially you will do equal as here or better than here in India. It's not very difficult to crack. After a few years, if you become famous in India, you will definitely make more money than here. So, and many people who have come here, there are surgeons and physicians also who have come here. I know many surgeons, neurologists who have come here and practicing. Probably they have come here not for financial reason. Financial reason is the second reason. The first reason is quality of life.
Got it.
So the infrastructure, the living, the structured work, these are the things that they come here for, not for money. So I would say the dependent branches, anesthesia, radiology, pathology, these are given very good importance here because they are considered the core of any hospital
Mm.
and they are the pillars of any hospital because these services define the patient safety. ICU, anesthesia. But in India, unfortunately, even though these are very important, the importance is not given that much because they say you don't get the patients. You are not the person who has got the money, got the patient and touch the money also.
Yes. Yes.
So you are
Correct.
not a primary consultant.
Yes.
So that is the kind of vision that people have in India and the managements in India will
Because
plateau you in
yeah,
a
it's
stage.
more in
So
the
after one
American
stage,
model.
yeah, after a stage you will get plateaued in India. You cannot grow beyond that. I have reached that plateau in India,
Yes.
and probably I made this move, and I don't regret it because I think I have a good lifestyle, good work-life balance, and I'm working with the best people in the world, and it made me grow. So
Correct.
probably in India, when I did my practice after 4 years, I reached a plateau. I was not learning anything. I was not evolving as a person.
Yes.
So it made me complacent, comfortable, and I believe once you become comfortable, you become complacent, and you'll feel that you know everything, and and that
Yes.
is where your growth, is done. So I feel
Yes.
you have to always challenge yourself and take up new situations, new challenges, and then only you will grow. So in that way, To summarize, this is the whole story
Yeah, got it.
of the
Basically,
doctors in
we
India.
get stuck in a comfort zone actually, yeah, for a period
Yeah,
of
yeah,
time.
yeah.
So we try to stay in that. So
Yes.
next,
And
so
then
yeah,
to increase your revenue or to increase your earning, you will probably have to take
yeah, yes,
more,
yes, more, yeah, more
and
responsibilities,
then
more
it will
tensions.
more responsibility. Your weekends will slowly start
Yeah,
going.
yes,
Your
yes,
family will slowly start
yes, yes,
complaining.
correct.
So this is what happens in our branches, at least in
Yeah,
anesthesia, radiology.
yes,
So very popularly, people come here, radiology, anesthesia, ICU, pathology. These kind of branches are very popular here. Most of them come here.
got it.
But the other branches, I'll say, though many people come here, it is not their first choice. They would have
Got it.
come because of other reasons.
I
Many of
understand.
the
I
reasons.
got to summarize. Basically, it is more of a service provision sector. Basically, what you're talking,
Yes,
what is better?
because if I tell you here, the beauty of this place is they give we as anesthetists and high performing surgeon
Yeah,
will probably be of the same salary here.
got
So
it.
the
I
salary
understand.
scale is not different for. So we don't get differentiated at
Yes,
work based on whether you get the patients or not. And this model is different. The
yes,
healthcare
yes.
model is different. So here the model is a insurance based model.
Yeah,
Everybody in this country is insurance is given insurance and you are covered. And so the even the hospitals here, though you perform very high, I mean you don't need to do if you do too much work also, it's not useful here.
got it.
So you
Quality
do
will
your
come
work
down.
in your you do your work in specific time and then you move out. So if you are working 8 hours in a day, you do proper 8 hours, and after that you are free. So even a
Correct.
surgeon, even a physician. But in India, it's there is never end to that.
In
You
India, there is
keep doing
no
case.
that timings they don't maintain actually in India. In that 8 hours,
Yes.
actually, sometimes you'll be free for 2 3 hours, and then when you plan to go home, then actually some work will
Mm.
start. It will go on like that. So
Yeah,
that's a
so it is
so
in that way it is very structured.
yeah, yeah,
Yeah,
structure. So basically, quality of life and the work-life balance, if somebody is interested in, and now many of the younger generation are actually directly they're calling me and they're telling their priorities. They're very different from us. They want their work-life balance. They want the life, and we were more ambitious. I felt actually. So they want
yeah,
the
yeah.
good. Yeah, you understand
I think
what
the
I'm like.
generations have changed now. Definitely,
Yeah,
the generations have changed now. Everybody now, the youngsters want, apart from money
they
and
want the life
financial
also.
stability, they want a good life also. So
Yeah,
things have changed and priorities have changed. Gone are those days where you keep working
good morning and
endlessly, no
yes.
holiday, no weekend. So many people are coming out of that. And I hope this translates into Indian medical system also slowly,
Yeah,
and we get better work-life
but
balance.
a typical clinician's life, I'll tell you in India, you take a general physician or any cardiologist or a surgeon, not the service provision sector like anesthesia, emergency medicine, and radiology and other branches. They work in the hospital. Evening again, they'll go to OPD. They'll work in the OPD till at least 8:30, and in the Bangalore traffic, and they go home by 9:30. So they're actually working for maybe 13, 14 hours in a day. That is a typical work pattern for all the clinical non-service branches.
Yeah, but a lot of other factors also will disturb your work.
Mm.
Like traffic,
Yeah,
maybe even your work definition in the hours that you work.
yeah,
So I'll tell you my work life
yeah,
balance or
yeah,
my work style. Maybe it was so I'll tell you in India how it was. Probably
yeah.
in India I
Yeah,
would
India and
work.
UAE, just tell me how it changed.
So in India I would work. I was the in charge position in the
Yeah,
neuro anesthesia there. So I used to manage 3 to 4 OTs in a day
yeah,
with my juniors and my colleagues.
yeah.
And I used to start my work around 7:30
Mm.
in the morning, and until the case finishes, I have to be there.
Mm.
So up to 5:30, sometimes 6, sometimes it might go beyond also. Then I
Yeah.
used to work 6 days a week, Monday to
Mm.
Saturday. And Sundays also, if I'm on call, I have to come. So basically, you're off very few days
Even
in a
Sunday also, if
month.
some aneurysm comes for a coiling or a clipping, then they might.
Yeah, you're basically, the moment you join hospital, it means that you are responsible for,
Yeah. So typically,
yeah.
it's a 10 to
So,
11 hours in a day, including some Sundays, maybe if you're lucky with
yeah.
that.
My only let out in India was conferences because when I used
Yeah.
to conferences, when I used to go to conferences, I used to take breaks. I used to meet my friends. I used to relax a bit. And That was my only let off time. Otherwise, I would do this. Plus, I would bring back academic work into home also. I would write papers, I
Yeah.
would do research, and all that
Yes.
was additional to my clinical duties.
In
No
workshops,
extra time
conferences,
for that.
also a lot of things used to conduct actually this
Yeah,
time.
you have to prepare all that. So that was my lifestyle. Now my life is 5 days a week. I work. I start at I start early. 6:30 I
Mm.
let go out of home.
Mm.
The travel time to the hospital is defined. It is 10 minutes. It is 10 minutes every day. So I reach in and then I enter my OT at 6:45 to 7. I start preparing my OT. Here the difference is I do only one OT at a time. I'm responsible for one list. And then I have to do everything. Mind you, in India, I used to get assistants for everything.
Mm.
Drug loading, that, this, wheeling in
Yeah.
patient, charting, everything here I have to do on my own. So it's a do-it-yourself kind of a culture. So you get tired at the end of the day, but
Mm.
you do everything for the patient. So errors are minimized and you're fully focused on one patient.
Got it.
We don't leave the patient unattended. From
Yeah.
the time we wheel in the patient till the time I hand over the patient in the discharge unit in the ICU or in the PACU, post
Yeah.
anesthesia care unit, I am totally with the patient. I am entitled to one coffee break of 10 to 15 minutes and a lunch break of half an hour. Somebody will come and relieve me. If the patient is stable and at a good timing, I go out and that anesthetist will be managing till I come back.
This is
I
exactly
finished
UK
by,
mode. It's
yeah, and then
UK.
I finish my work at U 4:30 is my
Mm.
logout time.
Okay.
And typically I don't extend beyond it, but sometimes if I extend beyond it, those hours are compensated. So
Got
they
it.
will be counted and then I
Yeah.
can take an off when I get, I know 10 hours to a chunk,
Mm.
then I can take 1 day off. So
Okay.
5 days a week. So I would say work-wise, I get equally tired as India
Yeah.
because here I'm doing everything on my own. In
Yeah.
India, it was more of a managerial role, more
Technicians
of
are there, no, in
management.
India. Yeah.
Yeah, and then residents, and you do
Mm.
this, you do that. You only go for critical moments, and then you're responsible morally, and you're thinking about the patient, but physically you're not there all the time. So you do everything yourself. You even though you are the head of the unit, you will do one list, one case, or one OT, and very structured. So this is the thing. So I work 5 days a week. Some hospitals work 6 days, 6 days a week here. Depends. So here also there are different kinds of hospitals. So
Yeah.
one is a government kind of hospital. Mine is a semi-government hospital.
Yeah.
So Cleveland Clinic is funded by the government and it works on a government model. So 5 days a week. So if it is a private hospital, you will work 6 days a week. It will be 8 hours per day. Cleveland Clinic works 10 hours a day for 5 days. So 50 hours. So average 48 to 50 hours is the number of hours you need to put. But it is very well defined.
Got it.
So, that I like. So I know I'm out on Friday evening until Monday morning, I don't have. So I can spend good time at home, good time with my family. So this is the kind of lifestyle that we have. So the difficulties that we would face here is one is culture
Yeah.
because there are a lot of diverse people here. So my nurse would be sometimes a Filipino nurse, surgeon will be a German, I am an Indian, my technician will be from UK. So we're
Got
all
it.
countries
It's good
working
actually.
together. It's a global, yeah, it gives you a lot of exposure
Yeah, it
and you
gives
learn how to
your
communicate.
perspective towards life will change actually. If you work
Yeah,
with.
in India, I mean, things are understood. You don't need to tell
Mm.
much. People do their work. Here,
Yeah.
you have to tell everything, each step. So, basic things, but it makes patient safety more important here. And so this is very different. So, culture of working will be different. Somebody comes here, it will take some time for them to adjust. It's not very
Got
easy
it.
to adjust
So
also.
here,
Yeah.
I would like to ask you one question. So basically, till now, if somebody has followed the video till now, they would have understood which branches are better, and then they would have understood how the life will be there. But now, one more important thing you told in the beginning. Thing is, if you are best in your particular subject, only then you will be taken into this. So, how to become the best in that particular subject? Also, if you can give some ideas, like whether you have to go to abroad or India only, you can become, or it's your personality. What is that exactly?
So nothing comes easy in life. Okay. So if you think that you will do your MD and come to Middle East and have a relaxed life, that is not the way it works. So most of the people here in Cleveland, like 30% of the anesthetists here are my colleagues are Indians, but most of them are from AIMS, PGI, JIPMER, these kind of central institutes, or they have done DM. Like in the neuroanesthesia team, we are three DMs. Three
Hmm.
Indians are three DMs.
Yeah.
So in the cardiac way, that way in their cardiac anesthesia team, they have some DMs.
Hmm.
So most of the people would have, kind of aced it in India. So you have to be one of the best there to come in here. They don't select mediocre people there. So You yourself will know where you stand in India and how good a chance you will stand to come here. So if you think you are mediocre and that's why you will come here, you will not stand a chance. You will not
Got it.
survive this market because this is very cutthroat, very competitive. And mind you, they have a wide variety of all the country people applying here. So
Mm.
they are not short of applicants. So if you are not good, if you are not professional, if you are not maintaining the standards, very difficult to keep a job here. So don't come with that mentality to all the people. I will think they will think Middle East, I'll relax, I'm mediocre.
Yeah,
This thing,
relax life,
it
more
is not
money.
like
That
that.
is what.
That will not sustain here. It is difficult because here everyone wants to come here, everyone wants to live here, and everyone. So what I would say the qualities to become successful here are the same qualities in India.
Mm.
We Indians are liked by most of the people in the world and most of the hospitals. Indians are employed because of few things. One is we are very sincere at our work. We are very high skilled.
Mm.
So, whenever you employ an Indian, they are sure that he will provide the best services and the best clinical services to that patient. Plus, we are very good in academics, research, and we are good people from good institutes.
Understood.
So, we do all this also. So, those are the key points. You should be high skilled, highly, you should have good fellowships or good experience in India. Then only you stand a chance to apply here. So those are the kind of qualities. Sincere, hardworking, all those are they come with the package.
Yeah, yeah,
So these are our plus points. Because the other country people are better in other ways. I
yeah.
can tell you this. So they are very good in communication, good in
Research.
presentations.
Yeah,
They are good in research because their training backgrounds are like that.
yeah.
So they have been trained in a very structured way. From the first year of their medical school itself, they are into research.
Yes,
They are
yes.
tuned in that way.
We are still
So
stuck in Indian healthcare, Indian postgraduate system is still stuck in the level of passing the exam. Okay? That's what I'll be
yes,
telling in all my videos. Passing exam is not
yes.
a big deal actually. It's not enough.
You
Actually.
need to acquire those soft
Uh,
skills, which are key skills, which will make you stand apart from other people. So that is what I would say. I would say if you are successful in India only, you can be successful. I mean,
correct.
if you need
Yes.
to be one of the best. So don't think about mediocrity and then come here. It's very difficult to survive. I'm talking about the cream hospitals. Okay,
That
so
is what
here
I'm
also
telling.
there
Next
are other
question is that.
layers.
Next question is
So here
okay.
also there are other levels of
Yeah.
hospitals. So I'm
Yes.
talking about the government and the best,
You're
like
talking
Cleveland
about best
Clinic,
hospitals. Yeah.
like Mayo Clinic. These
Yes.
are the kind of government hospitals here where the work-life balance, everything is good. There are other private hospitals also here, like
Mm.
Indian private hospitals
Yeah.
also are here, which are mediocre.
Okay.
There probably an Indian kind of
Regular MD will
work
work. I think.
regular will work, but again, see, you are anytime replaceable there also.
Mm.
Only
Yeah.
thing is if you stand out and if you are very good and that is when you will survive in any market. So it is not easy to keep those jobs also. It is very
Okay.
difficult. And probably if you work in such a field, you will not feel the difference also. You will feel like you're working in India only.
Got it. Got it.
So if you
In
want to
those
be in the best, then
hospitals,
you
they
need to
won't
do.
expect major research not to be conducted. They'll be expecting clinical work.
They'll be very good at clinical. Yeah,
Yeah,
clinical work they have to be very good.
very
Here,
good.
patient safety and patient, small things are also given very big importance. So,
Yes.
the way you manage patients, the way you communicate, the way you make patients comfortable, and then patient, these are all very high professional standards, I would say. So, you need to have the skill sets for, making that kind of practice here.
Yes, yes. But mainly
So,
MD and DNB, if you see, between both, what is your opinion? Like, I'll tell my
I
perspective.
don't think
Yeah, yeah.
I will tell you that I did MD.
You did.
Okay.
I also did
And
MD.
then, so then I went on to do my DM. But
Hmm.
if I were to go back
Hmm.
now, I wasted like 1.5 years to study for my MD, to
Yeah.
get an MD, because those days getting MD in All India entrance or state entrance was
Tough.
very difficult. But I wanted that because those days DMB pass percentage was less. But now looking back, I have trained so many DNB students, and those
Hmm.
people are doing very well now. So what I think is DNB is much better than MD. It's
Hmm.
a fact. Because in MD, in a medical college, the teaching is okay, okay. I mean, you have a
Yeah.
curriculum, you have all that. But the clinical exposure in a medical college is different. The clinical exposure in a corporate hospital is different. Because once you finish your degree, you will
Hmm.
want a corporate anesthetist. who is fine, who is very good skilled,
Mm.
who has seen all the complicated
Correct.
cases.
Yes.
These kind of cases are there only in few institutes. That's why the people from central institutes or the big institutes, MDs do well. The rest of the MDs, I would say you need again training after MD. MD
Mm.
will come, but after that you need again 1 or 2 years of good practice in
Where should they
corporate
work
hospitals.
if they really want to upgrade? Many
After,
MDs.
so these kind of things, if they are doing
Mm.
MD in a mediocre place where you don't
Mm.
have exposure to super specialty, high-end technology, you should go and work in a good multi-specialty corporate hospital, and you should rotate in all the branches: cardiac anesthesia, neuro anesthesia, pediatric, regional. In any corporate hospital nowadays, you will have specialists for each branch. So neuro, like in your institute, neuro will be for you. Like
Yeah.
regional anesthesia, one team will be there, pain will be
Yeah.
there, cardiac will be there. You have to rotate in all this
Yes.
after your MD for at least 6 months to 1 year, I would say,
Mm.
and then probably try to specialize in one of it. You should
See,
rotate
it
in
is.
all the branch subspecialties in a corporate hospitals,
Mm.
and then choose one of it as a, it's not enough to be a jack of all also.
Mm.
Jack of all is good,
Mm.
but you need to be a master of something.
Mm.
So probably do a fellowship, if not a DM, just
Mm.
get a fellowship in one of the subspecialties so that it will act like you are an expert in one thing, but you know everything. So this is a perfect combination of a good anesthetist who is wanted in every market.
Yes.
So I would say that there are some people in India who think after doing a DM, doing other branch work is a downstep for them.
Mm.
So you
Exactly.
feel after doing DM neuro anesthesia, the first thing that people tell me is, sir, I don't want to do any other anesthesia. I want to do only DM, only neuro anesthesia work
Mm.
because I feel I'm a DM. So why should I do any other? It is
Mm.
not like that. In the Western world, everybody who is a professional, or a 50, 60-year-old professor with great experience in neuro anesthesia also will do all other anesthesia, but his area of expertise is neuro anesthesia. So
Publications
our
will
work style
happen.
is yes. So our work style is also like this. So most of the times I work in the neuro theaters. I do neuro work, and I am required in the neuro team. But when there is
No
a
cases
day
there.
where there
Yeah.
are no cases or something,
Mm.
you have to be useful in other branches also, and you have to be capable enough to do other ones. You cannot say I'm not comfortable doing a spinal anesthesia. I'm not
Mm.
comfortable doing epidural. I'm not comfortable doing a basic case like a
Yes.
block, supraclavicular block. So what I'm saying is this kind of mentality works in India probably. If you do
Mm.
DM neuro anesthesia, I will do only neuro work and I
Yeah.
will not do anything work. And they think that doing something else is a down step. That is not that doesn't work in any part of the world except India.
Got it.
Because in India you will get good amount
Enough
of only
cases
neuro
are there.
work.
That is the reason.
Yeah. But
Not in
actually,
every
even in
center.
India also, where I worked,
Yeah.
I had a lot of neuro work, but those days when I didn't have neuro work, I used to enjoy doing something else. And on my on-call days, I used to do something else. So I think you should be open for all. Though
Yeah.
this mindset should change also from people who have done super specialty. That see, this is a next level of expertise that you have gained, but your basic skills should also be along with you. Then only you will be more employable in any market.
That's potentially
That
Dr. Shishir will be telling me all that. You have to get exposed to different cases. You learn something from there, which we can apply in Euro
exactly.
again, actually. Yeah.
Exactly. And then, at one stage, even it gets kind of monotonous if you're doing
Boring
only
it will
one kind
become.
of subscriber. Because, after one stage you have done it, and then you are not learning because in
Mm.
your place, you are the person who's doing. So you are only doing your things and you think
Yeah.
everything is in your way and you
Yes.
don't evolve. But here, there are different people in the neuro team itself. There are 9 to 10 neuroanesthetists.
Okay.
So each one does differently. So we learn from each other. And then from the other branches, when you go, so suppose I'm doing a bariatric list today. So different challenges, obese patients, this kind of how to manage drugs and how
Yeah.
to do obese anesthesia for
Yeah.
morbidly obese. So this morbidly obese can come in neuro anesthesia practice also, right? So it
Correct.
will improve yourself. Suppose I'm
Yes.
doing a pediatric list. The pediatric
Yes.
anesthesia team is separate. I work for the pediatrics also. But if
Yeah.
I get a pediatric neurosurgical case, then I'll be comfortable doing it.
Yes.
So, everything is like that. And,
That is what. See,
you should be a jack of
70%
all,
is, yeah.
but yeah,
70% is
jack of
general
all,
anesthesia
master of
skill.
one. Yes. So this is the requirement in probably everywhere else apart from India when you start working.
Yeah.
This will be the work structure. They are experts in one branch, in
Got
one
it.
specialty, but they are good in all other anesthetics. And they never refuse that I will not do this.
Mm.
But if you ask a fresh DM neuro anesthesia or a fresh DM,
They will not do.
they'll say first thing they will ask is, I won't do anything except neuro anesthesia because I have done a DM. That
Yeah.
ego, I think it will only reduce your market and your area of your chances of getting employed.
Yeah, actually, the problem is if you try to restrict like that, you have to work 24 hours.
Yeah.
If you train a system, then you can take off sometime. So Nitin, I would like to ask you another question. It is now very below average student is there. Okay, because we are talking about the cream of India, a below average student, which constitutes 80% of the MBBS crowd actually. So if he has to plan, his skills will be average, his no, whatever capacity will be average, but his aim is to earn money and have a balanced life in Middle East. And he finished his MBBS. How should he plan within his capacity? If you tell him to get a seat in middle aims and all that, he will not be able to do that. How can he plan to get into a B grade hospital, not in your hospital? How can he plan?
Very good question. First thing is, all this mediocrity in MBBS was up to that stage. Okay. And once you have joined your MD, it's a fresh start to your life.
Yeah.
MD or DNB is the first step. Until then, whatever MBBS you did, whatever medical schooling you did, I say is not very important. So you can take a fresh start from it. I was a very mediocre student. Let me be honest and tell you that I have passed all my MBBS exams in the first attempt, but I never topped any exam. I never, I was not one of the studious kinds. I was more into sports. About I used to represent my college and university in sports and all that. Yeah, so I was busy with all this. I developed an overall personality, I would say, but my academic MBBS knowledge, that's why I probably took some time to get my MD also. I took 1.5 years to crack the exam. But after my MD, I changed. See, if you are thinking you are a mediocre student, I'll tell you, if you join MD or diploma, even if you join a diploma, the first day of your training, that is when your life will start. So start changing yourself, start developing an attitude that you will learn, you will read, because these skills in your training will be with you all your life, and this will shape your life. So whatever before that is nothing matters. So if you're a mediocre student, below mediocre student, if you have not got MD, if you have got only DNB, or if you have got only diploma also, I have seen many diplomas also, anesthetists, who are doing very well in life. So what matters is how you do your postgraduate training, and then how you develop a personality and how you become after that. So you have to have some key attitudes like learning, sincerity, hardworking, should be very inquisitive. And you should go back and read whatever you are seeing. So you see something new today, go and read. It's not very difficult, I'm telling you, because from here it gets easy in life. In MBBS, probably you would have read what you will not do. And from the day you start your MD or DNB, you will read only what you will do for the next 30, 40, 50 years of your life.
Yeah, perfect.
So you will be interested, and you should be interested, and you should put all your life and mind in it, and do your residency very sincerely, take your seniors and your teachers very sincerely, and come out, and then again better your skills, and then this is what I would suggest to people. So mediocrity, don't worry about it. I would say 80% of the anesthetists were mediocre students. This is a fact, I will tell you. Because in my days, or previous to my days, most of the people who took anesthesia was not a very sought after branch. Only very few people took anesthesia by choice. Most of the people took anesthesia without choice. Everything was over, only anesthesia, some branches like ENT, Ophthal, pathology, or something was left over, or diplomas were left over. They took an MD anesthesia. Some people take it because it is an end subject. Okay, I will take anesthesia. But mind you, anesthesia is not an end subject in this world. So now if you do MD anesthesia, it is like a basic surgery. You have to do some special training again. Like I told you, how you need to rotate and then get skills, and then already, also get an expertise in one of the subspecialty. So mediocrity till now should not be a factor. I would say in anesthesia, some key things what a successful anesthetist, what are required in a successful anesthetist is, one is your sincerity. So long hours, staying with the patient. Second thing is, if you're very, you want to become very popular, you want to become very
famous.
So that kind of a personality, if you have, you want to have so that kind of personality, anesthesia is mostly a back branch. So you are doing the supportive work. Yeah. So behind the screen, you're doing all the work. And you are very responsible. You are actually the pilot of the aeroplane. But nobody remembers the pilot's name. They will only remember the carrier's name. So today you will fly SpiceJet or you'll fly Air India, they will remember only the aeroplane brand. Nobody will remember the pilot. So you are the pilot of that aeroplane. So that kind of a branch. But the advantages of doing anesthesia will be, I would say, you don't have to deal with a lot of tricky patients, and this era dealing with patients also is very difficult. Sitting in the OPD, explaining to them, talking to them. Minimal talking will be there in anesthesia.
Yes.
And the thing that I liked about anesthesia is you will see immediate response.
Yeah.
So in medicine, you will get a patient with diabetes, hypertension, cold, cough, fever, infection. You will start a medicine after 1 week, 10 days, slowly. Here it's nothing. It's a matter of seconds. So you give a drug, immediately you will see the effect. You can change the heart rate, you can change the blood pressure,
Yeah.
you will intubate, ventilate. So it's a high adrenaline branch. So people
Yes.
who are interested in clinical work, anesthesia, nothing will be writing, documenting, or prescribing. It will all be procedures and immediate changes with the patient's vital system. So very, very exciting, I would say,
Yes. Now
branch.
bright
Uh,
days are taking up.
yeah. And also people who are very maybe because there's a lot of adrenaline involved in anesthesia also.
Yeah.
So if you're a person who is a little panicky or something
Yeah.
like that, then this branch will probably not
Not
suit you because
not suitable.
this one you have to be very strong. So if everything is going wrong, the last person in the room to be, you should be the person who is standing a firm ground and giving the confidence to the team that even though there is a lot of bleeding going on in a surgery and the patient is going down, sinking, but because you are the captain of the ship, you should maintain
Yeah.
a poker face and say that everything is well, we will manage, and give the confidence to the team, the surgeon, and then the patient can be saved. So, you need to be that strong
Got it. Got
personality
it.
in the team. So these are you have to be very strong hearted.
But in that
So
way, actually, I seen you managing. I learned few things from you. When crisis is there, you will be more stable and you'll be calm actually.
yes, so never show your what is
Yeah.
inside to your surgeon. So
Yes.
as the like I'm expressive now, or between friends we talk, and in
Yeah.
the war I'm very poker faced. I maintain my, because I am the in charge in the room of that patient in a surgery happen, whatever is going on. And you should never let the people know that you are frustrated or there is bleeding, you are worried. So these qualities are important for a successful anesthetist. And you cannot learn all this, but it will come with your training. If you train in a good institute, you'll see all the complicated cases. You will see how your senior anesthesiologist is managing, and then you will learn from them. And that's how a successful anesthetist is made or developed or molded, I can say.
And simulations also help actually if they attend.
Yes. So definitely, either you learn by directly seeing difficult cases,
Yeah.
or you learn by simulation. So we have a simulation center here.
Yeah.
Our anesthesia training, we have anesthesia residents here.
Yeah.
We train anesthesia residents. So we do a lot of simulation in them, because I probably would not give them that kind of exposure clinically, because they would probably not see 10 difficult intubations
Yeah.
together, but 10 difficult intubation scenarios we can make them simulate, and then we can see how they react, and we can tell them this step was wrong, this step is we can improve. Simulations do help a lot.
In India, JSS Mysore has got a simulation lab. They have the whatever you're telling, the airway simulations and cardiac simulations and all. So
Very good, actually. Simulation will be the next future, I think, for training, because what you see, there is a way how you approach a crisis in anesthesia. Whenever a crisis happens, you go one, two, three, and that structure should come with training. You cannot do it directly on a patient. So you will fumble. Any successful anesthetist also, if he faces a crisis, you should, if you go back, that's why they do a lot of debriefing in a team.
Yeah.
So here also, whenever we have a difficult case, we manage successfully or not successfully. At the end, we have a team meeting and each one talks. And each one is given equal importance. Also, even the nurse will tell, Doctor, I feel that this was not the correct thing. We could have done this.
Yes.
So we discuss, and then we think. So when you talk, when you debrief, then you learn. And the next time you face a similar situation, you will perform much better way.
Got it.
So that's how simulation works. So this all structured training is there here and in the West.
That is not there
in India.
India, it's not there.
Yeah, but I will tell you what, because I'm also trained in India and I was trained the other way. But in India, you see so many cases, the volumes are so high that eventually all the simulation exercise will keep happening on the background. You will not realize that this happening. Because I'll tell you, the number of cases that we have done in our residencies or in our training, is much more
Much,
than
much
what the
more.
other people in the world have done. So the same trained person from India would
Mm.
be 10 times high volume he would have encountered in his clinical work than the same person who was trained in the West. That is our advantage. That's why I tell, clinical expertise, skills. These are all our, because
That
they
is,
know that we have done a lot of
but
cases.
that is when
Yeah.
we did our post graduation. Now the number of seats have become 10 times, and patients
Yeah.
are the same, and the number of hospitals have increased. So there is a certain amount of dilution which has happened. So
Yes.
when we were operating 30 to 50 cases, we were doing in a
Yeah.
operating room. Now in medical
I think all
colleges
this will affect what you're talking about, Dheeraj, will affect surgical skills or
and
surgeons or other people.
yeah,
For anesthesia, I think it will not affect that much
one,
because
one, 2 cases in a day is nothing.
because anesthesia, you are anyhow doing one OT in one
Yeah,
resident will do one OT. So numbers will not affect the this whatever
got
factor
it, got
you
it.
are talking about.
Understood.
So that way, anesthesia, you're lucky that you're. I mean, I think Indian training is the best for anesthesia. I've seen very, very successful anesthetists who are trained in India, then went abroad, did another residency like UK, they did their US UK
Got it,
residency or US residency. So they say it was one cakewalk for them.
got it.
Getting in was difficult, but clinically they were on par
On
or
par, yeah.
above par because you have done it all. Only thing
Yeah.
is you need structure, you need those
Refinement.
structured way of learning,
Finesse
refinement,
is
these skills.
required, yeah.
That is only what you will learn. But apart from that, clinically, you have done everything in India. Indian residency is very good. So, if you are a mediocre student, if you are listening
Hmm.
to this lecture, mind you, there is nothing mediocre about you now. Once you join your MD or DNB or DA or whatever, that day your
Diploma,
life starts
yeah.
and give your heart and soul to the subject. And it's very easy. You put your everything into the subject, you learn, and you evolve, and then you will be successful. Definitely, not very difficult. After even if you do from a very mediocre place, there is so in India the advantage is even if you do a DNB from a very small private hospital, if you
Hmm.
think you successfully pass, you can go and work in a big institute because there is
Yeah.
always need for anesthetists all over the country in good
Yes.
centers. So anytime you will get the best hospital in any city, you will get a job there. So
Good.
this is the only branch where you will get jobs everywhere in the best hospital. Go there, work for 1 or 2 years, you will develop skills. So
Got it.
even if you don't get a good rank, good seat in a good college, good degree, like you got only diploma, don't be disheartened. You can still cover up easily. In anesthesia, it's very easy to cover up. And in anesthesia, the skills are they're not like surgical skills, like you need 10, 15 years to develop.
Hmm.
Here you can develop in 1 to 2 years very nicely. You can develop and you can become a very good clinician. So don't get disheartened if you don't uh, have like this best degree, best college, all that criteria which all the people take in the first ranks. Still,
Yeah.
you have a very good chance of making it big in life, like how we did. Like I think
Yeah.
Dheeraj, you
I'm
did from a
also
very
very
decent
average, yes, student in average college, private college. I did.
and and he was our first rank holder in the DM neuroanesthesia entrance ranking. Though you did
And
your medical, your MD
private
from
college.
okay private
Yeah.
college in
Yes.
Andhra Pradesh,
Yes.
but you are one of the best students in NIMANS. You are one of the toppers in neuroanesthesia, and you are one of the best neuroanesthetists in the country now, in the city, in the state, and the country also,
Thank you. Thank
because
you.
of what you did in your training. So I asked you, in your training, what did you do? I know you have put your heart and soul in your training
Yes.
and what you were before that was different. And when you joined your MD, that day you started working hard and you
Yes.
became. So I have seen you in your training and how we've learned together. So
Yes.
that easily you can even a mediocre student can make up in life. So not
We
a
worked
problem.
very hard in the DM time. Apart from our
Yes,
clinical work, also we have extended our clinical work timings and we worked actually.
yes.
So
So some other things like you learn your clinical skills.
yeah.
You go attend workshops, develop skills because everything you will not learn in your own institute. You should go attend conferences, learn from different people, learn from
Yeah.
different things. In India, a lot of workshops. In the outside India, it is so expensive to attend even one conference to develop. Now, if I go to one conference and have to learn
Mm.
something, learn new skill, very expensive. In India, the conferences,
Yeah.
workshops are very, very cheap.
Very cheap.
There are people willing to teach
Mine is
all
free
the
only. My
teaching.
hospital observership is free.
So, there's so much learning that can happen in
Yeah.
India. And in India, the anesthetists also are very hungry to learn. If you meet
Yeah.
an Indian anesthetist, you will understand like he's hungry to learn new things. Oh, what can I do? What new can I do? How can I do? So that is
Yeah.
the kind of attitude that you need to build. And Not very difficult. You can catch up very easily also, even though you have done
So
from a
a
mediocre
mediocre
place.
student also can succeed, but he has to put his heart and soul, work hard, and that is the way. And he
Definitely.
should be in right places with right people also. That also matters. See, you are
Yeah.
correct, no? See, we
Yeah.
both are fortunate to
Exactly.
be with right people in the right time and right place. That's why our careers are actually
Right. But it's not like a matter of luck that
not
right
luck.
people
We
go
chose
to
to
the
be in
right
that.
place.
Yeah, yeah.
Yeah. So it's not luck that the right person goes to the right place at the right time. That happens over a journey. So
Mm.
right from the first day of your MD, if you start planning, okay, I will do this, I want to do, keep high targets. Okay,
Yeah.
I will do a DM or I will do a fellowship.
Mm.
And if you like they say, if you aim for the stars, at least you'll reach above the ground. You'll go
Yes,
into the sky.
correct.
So that is the attitude that you need to have.
Yes.
So that will take you.
So anything else, Nitin, you want to conclude to the MBBS fresh pass out people who are watching this? I think till the end, they will watch this interview because it's you have told golden points to that with your 2 decades of experience. So an MBBS
Hmm.
pass out guy who wants to take any branch, not only anesthesia, how, and then your conclusion points to that, how to be passionate and how to actually beat
If you are an
competition in future.
Yeah, okay.
How to beat
If you are
competition,
an
how,
MBBS
yeah.
guy, if you are an MBBS guy, if you're thinking about taking subjects, choose wisely. Look, I tell you why I chose anesthesia. I chose anesthesia by choice. First thing, because it is an end subject. I thought so, but it didn't turn out to be. Second thing, it's a lot of clinical work. So I don't want to sit on an OPD, write prescriptions for cold, cough medicine, diabetes, hypertension. So, that kind
Yeah.
of thing doesn't excite me. So, and then easy jobs. As soon as you
Mm.
finish, you will get
Mm.
job. No
Mm.
anesthetist will be unemployed in India. I can tell you, even
Yeah.
if you do any degree, any diploma, anywhere, you will get a job. So how you want to excel is your journey from there. If you want to stay in a very in a second tier town or a city, you can practice with basic skills also. You don't need to. There is ample work for anesthesia in our country till now. So those are the advantages. Disadvantages will be you will probably reach a plateau.
Yeah.
You cannot make it big like a successful surgeon. A successful surgeon will eventually drive an
Yeah.
Audi or a BMW.
Yes, yes.
An anesthetist will never drive a BMW
Yeah.
or Audi until he goes into management. This is the reality of
Okay.
anesthesia. So you will drive a good car. You will drive a Skoda or
Yeah.
a Honda. Yeah. So these kind of cars. But then then if you want to go ahead, then you have to evolve. You have to become better. So how
MBA
to
we have
become
to
better
do.
is, yeah, maybe
MBA, no?
management or do super specialization or go abroad. These are the next steps in life. So that's what, you should not plan this initially. You should not plan that I
Mm.
will go to Middle East. It
Yeah,
happens
correct.
over a journey. I
Okay.
think that is how the best people also are here because they have come in
Mm.
the right time, in the right place. So I am very happy that I came at this stage of my life. If I would have come very earlier also, my skills would have not been that great.
Mm.
I would have been a mediocre guy.
Yeah.
Probably I acquired the skills, I got the degrees, I did a lot of work, and now I'm
Mm.
here in this time. So I feel happy. I don't regret that I've come in this stage. Many people come later also. They come in the later half of their career.
Yes, yes.
45, 50 also they move here because they have reached a plateau.
Correct.
So this thing. And you always try to stand apart. My key points to the learning postgraduates or who are going to enter projects, try to stand apart. So if there are 10 people, you should try to stand apart. So how you will stand apart is by developing good skills like attending workshops, going to conferences, and doing publications. People don't give importance to academics, to
Yeah.
and publications, to do research.
Yes.
These kind of things are very important because 10
Simple case
anesthetists will do
reports there
10.
can be. Correct, no?
Yeah,
Simple case
everybody
reports.
can do clinical work. Everybody knows
Yeah.
that. But when you sit for an interview, these things will stand out. So
Yeah.
try to do something like that and try to learn the best things from each of your guides or teachers.
Yeah.
Each one will be different in a different way, and he will have some skills. So have the learning attitude and learn from them. These all will help you. And don't be disheartened. Anesthesia, if you take anesthesia, it's a wonderful subject. You will enjoy it, and you will have a beautiful journey ahead in life. So you'll enjoy. Don't worry.
So I would conclude saying what I used to do is I used to try to be in cases where problems are supposed to happen, like very high risk cases. And during my MD time, or if some problem is happening in the OT, I should take permission, slowly sneak into that place and see what is happening there. And some of
Yes,
the assistant professors are very tough to work. Try to be with them actually. They are tough because they're trying to
exactly.
teach you.
Exactly. That's what they say. In your residency, you can make any number of mistakes and you learn from those mistakes and you
Uh,
see those complications. That is when your practice becomes easy later. So Actually, even today, if there is a complicated case in institutes like where we are working, they will always feel comfortable giving it to an Indian anesthetist because we are ready to take it because
Yes.
we have seen it, we have done it enough. So, this kind of training only helps. So, try to have that attitude. Don't run away from work or complicated work. At
Yeah.
least in your residency and all, you have to have the learning attitude. So, very simple things, but will take you a long way.
Okay, thank you, Nitin. Thank you for your time. This
Thank you,
video
Dheeraj.
will reach thousands of people. I'm very sure. And your advices are like golden points for them, like 10 commandments. So for younger guys, the valuable points you have told them. And my comments will come. So we might have to do a follow-up a Q&A session in future. Once it crosses 5,000 views, in maybe 1 2 months later. I think August, I think the counseling will start, I think so mostly. So before that, maybe one more Q&A session if we do, it will help them a lot.
Sure, sure. I'll be happy to help anytime.
Yeah. Thank you, Nitin, then. Okay, then as
Thank you,
usual,
Dheeraj.
Dr. Dheeraj Masapudheeraj logging off. Roger that.